My name is Josh Evans. I was born and raised right here in Omaha, Nebraska, but then was away for about 15 years or so. I went to I did my undergraduate work at Rockhurst University in Kansas City. I attended medical school at St. Louis University, and then completed my internship and residency, as well as a year as chief resident at the Medical University of South Carolina in Charleston, South Carolina. I then went on to subspecialize and did a fellowship in gastroenterology and hepatology at the Medical University of South Carolina. So in gastroenterology and hepatology, I treat any patients in the office with symptoms such as abdominal pain or heartburn or diarrhea or constipation. Those common symptoms, sometimes people are embarrassed to talk about them. And so they come to me without a diagnosis frequently. Other times I'll take care of patients with certain specific ailments, such as Crohn's disease or ulcerative colitis. I'll take care of patients with pancreatitis or pancreatic cancers. And then I also perform endoscopic ultrasound, which helps stage specific cancers of the GI tract, like esophagus cancer, stomach cancer, pancreatic cancer, and so forth. Let's say you come to see me as a patient for the first time and you have a diagnosis. You have Crohn's disease, or you don't have a diagnosis, you have abdominal pain. What I want to know is how the symptoms are impacting your life. I'm not going to sit there and tell you, this is the best treatment for Crohn's disease, or this is the best treatment for colitis, or this is the best treatment for heartburn, and this is the latest data. What I want to know is, what are you feeling? And if I can make your life better in one way, what symptom could we improve upon? Because no matter what the latest research and data shows, if I put you on a medication to make your Crohn's disease feel better, but your biggest complaint is that the urgency to move your bowels is so embarrassing at work that you're still having problems with that, then we need to work on that in a different way. The opportunity to work at the University of Nebraska Medical Center is an incredible opportunity. I've always enjoyed teaching and working with students. And by taking care of patients, you have a far reach. But by teaching medical students who then go on to become physicians themselves and take care of thousands of patients themselves, obviously you're having a far greater scope of practice. And so that impact on medical students, I remember many of my mentors who had a great impact on me. And I guess it's like any sport, or if you have a great coach and you decide to go into a certain sport, if you have a great mentor or a teacher who sparks your interest, then that's really impactful in your long-term career.